Bismillahirrahmanirrahim. Assalamu alaikum, my YouTube family. We are back with our new episode, which is episode 2 on angina. This is the part of our CVS lecture series, and let's get started with it. Angina. General information: angina, chest pain. Okay, patient may suffer chest pain, pressure or tightness caused by ischemic heart muscles of coronary arteries. So this is the condition when you feel chest pain or the pressure or the tightness or caused by ischemic heart muscles of coronary arteries. Stable angina, unstable angina, Prinzmetal angina. What is stable angina? It's also called stable ischemic heart disease. SIHD is a form of ASCVD with predictable chest pain triggered by exertion or emotional stress by relieved within minutes by nitroglycerin. Unstable angina is a form of ACS, medical emergency, that is not relieved by nitroglycerin. That is very important point. Prinzmetal angina, chest pain caused by vasospasm or coronary arteries, occurs at rest and caused by lit drug use such as cocaine. So you can know stable angina relieved by nitroglycerin, unstable angina not relieved by nitroglycerin, and the Prinzmetal angina which is mostly caused by cocaine or illicit drugs, the drugs which is abused by a patient, narcotics patient. What is pathophysiology? Chest pain occurred due to imbalance of myocardial oxygen demand. Okay, it means not enough oxygen supplied to heart muscles or artery and blood flow supply. Now obviously the oxygen is carried by blood. If blood is enough, then oxygen is enough. SHID is due to atherosclerosis, aka is also known as coronary artery disease. Atherosclerosis, it is the कोई क्लॉट जो है वो हार्ट आर्टरी जो होती है, जो ब्लड सप्लाई कर रही है, वहाँ पर जो है वो स्टक हो जाता है. तो मोस्टली जो स्टेबल एंजाइना है ऐसा ही वो इसी वजह से होता है. सो हाउ यू कैन डायग्नोसिस? कार्डियक स्ट्रेस टेस्ट परफॉर्म्ड, मेकिंग patient exercise to look for or by using drugs like dipyramide, dipyridamole, adenosine, regadenoson, Lexiscan or dobutamine. Okay, this is the kind of test we can perform for the patient diagnosed angina. The exercise, it means the patient can't enough exercise because due to less oxygen their lungs they start exhaling very start breathing very hard. It's difficult for them to take to breathe. Evaluation: history, obviously, CBC, obviously, CKMD, it is a protein present in the blood. This is raised by the heart. So there are the following proteins like troponin in IT and CKMB. These both protein, when the heart muscles tear, these protein release in blood. So it means there's any injury caused to heart. So APTT, PT, INR, you already know, lipid panel, ECG, cardiac stress test, catheterization, angiography. Everyone should get pneumococcal vaccine. What are the risk factors? Hypertension, smoking, DLD, diabetes mellitus, obesity, lack of exercise. Known drug history: eat healthy. If you want to treat yourself, you make yourself healthy, you should eat healthy. You should maintain your BMI 18.5, 24.9, waist 35 by 40 inches, do exercise, E2H, which is not recommended in my country. ethanol. Not in my country, which is also not recommended by doctors. So half drink, don't drink too much. So here are the treatment approach. We use antiplatelets, which we also call anti-anginal, beta blockers, cholesterol, yani statin, smoke cessation. It depends on the patient health, diet or diabetes. If a patient having diabetes, we should go for maintain their diet. Exercise, obviously we exercise, we educate them about exercise. Antiplatelets, take without regard to meals, help to prevent clotting issues. Bleeding, bruising is common. Avoid alcohol due to stomach bleeds. Obviously it can irritate your stomach. Okay, further drug treatment. What is drug treatment? Drug treatment is ASA, clopidogrel, which is available by the name of Plavix, or if patient has ASA, allergy or CI. Okay, we use clopidogrel if the patient has aspirin allergy. Acetyl salicylic acid. ASA is aspirin, which is available with common brand. Okay, DAPT, Plavix. Okay, if the patient has aspirin allergy, most patients have aspirin allergy, we use clopidogrel. Okay, and in DAPT we use Plavix 75 mg, aspirin 81 mg for 6 months after stunt, when patient got stunt, or 12 month post cabbage. और when उस पेशेंट को हम कैबेज देंगे तो तकरीबन 12 मंथ तक हमने उसमें यूज़ करते रहना है. अगर स्टंट है तो 6 मंथ तक, और अगर कैबेज है तो 12 month तक. These I will tell you, these are the both treatment which is non surgical treatment, non drug treatment. एंटी एंजाइनल फर्स्ट लाइन हमारे पास आ गई बीटा ब्लॉकर, सेकेंड लाइन हमारे पास आएगी सीसीबी और एलए नाइट्रेट्स आएंगे. एलए इज लिंगुअल नाइट्रेट्स, लोकल इफेक्ट, एंड रनोलाजीन प्लस माइनस बीटा ब्लॉकर हम देंगे नहीं देंगे, इट डिपेंड्स. इमीडिएट रिलीफ के लिए आपको नाइट्रोग्लिसरीन देनी है, सबलिंगुअल, LASL इज सबलिंगुअल या फिर पाउडर, और ट्रांस सबलिंगुअल स्प्रे. ये 3 चीज़ें में अवेलेबल होता है. तो जब सबसे पहले आपने जो है वो नाइट्रोग्लिसरीन देना है पेशेंट को. रूट आपका जो है वो सबलिंगुअल होना चाहिए, ट्रांसलिंगुअल स्प्रे या पाउडर, विच इज़ रीजन बिकॉज ऑफ अर्ली इफेक्ट, बिकॉज हमें लोकल इफेक्ट देना है एंड इमरजेंसी ट्रीटमेंट है ये. लेट्स डिस्कस एंटीप्लेटलेट्स एजेंट. जेनेरिक एस्प्रिन, ब्रांड Disprin, Bayers, Bufferin, Ecotrin plus omeprazole combination also available. Okay, it's better to use omeprazole combination because if you are going to use for a long term, so it's have a very serious side effect on stomach, aspirin. So now these are available with omeprazole combination, which is best for you to prevent stomach ailment. Okay, mechanism of action, irreversible COX 1 और 2. irreversible है, COX पे एक्ट करेगी 1 पर भी 2 पर भी. Prostaglandin decrease, thromboxane A2 decrease, antiplatelet, antipyretic, analgesic and anti-inflammatory properties. What are the ADRs? Dyspepsia, heartburn, nausea, tinnitus. Okay, warning, bleeding, avoid alcohol or other blood thinner if you are taking aspirin. This is a very serious warning. Okay, NSAID or aspirin or any other NSAID allergy patient not use it. If you have asthma patient, you cannot use it. Children with viral infection or Reye syndromes, okay, don't use this. It can lead to Reye syndrome. Okay, history is for life, obviously बात है. You can, if you are patient with angina, you may be used for a long term, and these are also available in a which is also available in a coated form, so which is very good for your stomach. Chewable 25 mg is preferred, or DrAmna, Yosprinla, not to be used when rapid onset is needed. What I talk about, the coated form is available, which is DrAmna and Yosprinla. You should not use in coated form if you are using in emergency, because these coated form release slowly. If you are in emergency condition, you need immediate effect, don't use it. Okay, another if you have allergy with aspirin, or the aspirin is not enough, or you need to use combination with clopidogrel, which is available with name of Plavix. It reversibly inhibit P2Y12 ADP, preventing platelet activation and aggregation. This is a pro-drug which prevent platelets activation or its aggregation, or prevent developing of clot. GI hemorrhage and hematoma and pruritus, which are common ADRs of it. Test 2C19 genotype if you are using clopidogrel. Serious bleeding. Okay, bleeding stop 5 days before surgery. So if you are going to surgery, what cabbage or angioplasty, so don't use it before stop. You should stop it before 5 days. Avoid with omeprazole or esomeprazole. It is not recommended to use with omeprazole or esomeprazole. It is it's absorbed in the stomach, and omeprazole also decrease HCl concentration. It requires HCl. So these kind of drug interaction are mostly in the drug dissolved in stomach. So TTP has been reported. Product converted active to active metabolite by CYP2C19. So this is a prodrug which is activated by CYP2C19. So you need these CYP2C19, which is why you need to test it. You don't have to C19 CYP, so cytochrome. So it means the drug is remain pro and not deactivated. So if you are a patient of angina, then there's anti-anginal drug which is first line. You should go for a beta blocker, which is not recommended in the first line in a hypertension patient, as we had discussed in this chapter. So beta blockers first line drug in stable. Okay, we are talking about the stable angina. So how it works? It reduces oxygen demand because it decreases contractility and activity of heart. So it's the oxygen demand is reduced, and the heart rate is reduced, and contractility is slowed down. Warning: avoid in presmetal angina. If you have a drug-induced angina, then you should avoid it. Okay, no. Titrate to resting heart rate 55-65 BPM. Okay. If you are suffering this, titrate to resting HR हार्ट रेट 55-65 है, तो आपको थोड़ी सी डोज कम करनी है. कैन बी अलोन और इन कॉम्बो विद CCB नाइट्रेट्स और रेनोलाजीन के साथ आप इन कॉम्बिनेशन भी ले सकते हैं. ओके, कैल्शियम चैनल ब्लॉकर preferred in presmetal angina if the angina is caused by the drop. So warning: avoid short-acting CCBs, nifedipine. If you are using short-acting intrarectal route CCB, so you should avoid this. Okay, second line drug है. If BBs, beta blockers or add-on beta blockers भी use कर सकते हैं. Okay, DHP I have talked about earlier in hypertension detail about DHPs. Preferred as add-on with BB. If you are using in combo with beta blockers, so you should go with DHPs, not non-DHPs drug. Calcium channel blocker. Ranolazine, which is available in Ranexa, inhibit sodium current and calcium to decrease oxygen demand. The same work. EDRs, dizziness, heart, headache, constipation, nausea. Warning: QT prolongation, liver cirrhosis, CYP3A4 inhibitor and inducer. Okay, it has no effect on heart rate and blood pressure. Oh, that's very good. No effect on heart rate and blood pressure. Limit dose to 500 mg BD if taken with modifying CYP3A4 azole or non-THB CCBs. Can be used with other drug. Avoid grapefruit juice, as I told you. This also inhibits CYP3A4. So that's I have earlier given you brief detail about why we should avoid CYP3A4 drugs with using grapefruit with the CYP3A4 drugs in hypertension lecture. Okay, let's talk about nitrates. Avoid if you are taking nitrates, avoid sildenafil, tadalafil, vardenafil, vanafil, रियोसीग्वाल. फ्लशिंग कॉज हो सकती है, हेडेक हो सकता है, ओवर टाइम. अवॉइड गेटिंग अप टू फास्ट. ओके, सो लेट्स टॉक अबाउट नाइट्रेट्स. नाइट्रोग्लिसरीन सबलिंगुअल टैबलेट, नाइट्रोस्टेट. mechanism of action, nitroglycerin TL spray, trans-sublingual spray, nitroglycerin sublingual powder which is available on Go Nitro, nitro mist is spray, nitroglycerin ointment, nitrobid. ओके, शॉर्ट एक्टिंग नाइट्रेट्स है, ऑक्सीजन डिमांड डिक्रीज कर सकते हैं, ऑक्सीजन की सप्लाई को इंक्रीज करेंगे और प्री लोड टाइम को भी डिक्रीज करेंगे. ADRs, dizziness and lightheadedness, flushing, syncope हो सकता है. So warning: hypertension in patient having hypertension issues, headache and tachyphylaxis tolerance. In patient having tachyphylaxis, it's having tolerance with nitroglycerin. Caution with antihypertensive patient. If you have antihypertensive patient, you need caution. PDE5 inhibitor. Avoid for 12 to 48 hours after or riociguat. Okay. इंट्राक्रैनियल प्रेशर इंक्रीज हो सकता है. PDE5 इनहिबिटर्स अवॉइड फॉर 12 से तकरीबन आपने 1 से 2 दिन जो है वो इस ड्रग को नहीं लेना है. अगर आप कोई PDE5 फॉस्फोडाइस्ट्रोलाइयर इस तरह की अगर आप ड्रग यूज़ कर रहे हैं तो आपने इसको अवॉइड करना है. नोट्स: कॉल 911 इफ चेस्ट पेन डज नॉट गो अवे आफ्टर सबलिंगुअल स्प्रे और पाउडर के बाद आपने कॉल करनी है इमरजेंसी. यूज़ PRN फॉर इमीडिएट रिलीफ and keep in OG glass amber wine. ओके, ड्रग को आपने जो है वो उसके ग्लास में रखना है, ठीक है. एंड ओके, काउंसलिंग एंड सेकेंड इज अबाउट nitroglycerin patch, which is available nitrodior, isosorbide mononitrate monacate, isosorbide dinitrate, isodyl and tetradose or dilatrate. It is a long-acting nitrates. Oxygen demand decrease, oxygen supply increase, preload decrease. This is a long-acting, which is our short-acting. It is used short-acting, obviously used in and immediate effect, and long-acting for the long term. The same ADRs, dizziness, lightheadedness, flushing, syncope. The same warning: hypertension, headache, tachyphylaxia, antihypertensive patient. Same with PDE5 inhibitor. Avoid intracranial pressure can increase. Notes: long-acting nitrates only used second line plus minus with beta blocker, not in first line. And 10 to 14 hour nitrate free period to reduce tolerance. Okay, तकरीबन हमारे पास जो है वो नाइट्रेट फ्री पीरियड होता है टू रिड्यूस टॉलरेंस से. इससे आपको जो है टॉलरेंस जो है वो कम हो जाएगी या आप प्रिवेंट कर सकते हो. ओके, अब हमारे पास आ जाती है देयर आर सम काउंसलिंग फॉर एंजाइना पेशेंट. नंबर 1, लेट डिजॉल्व अंडर टंग. इट इज़ फॉर अ सबलिंगुअल ड्रग, शॉर्ट एक्टिंग. लेट डिजॉल्व अंडर टंग और बिटवीन चीक्स और गम्स और टीथ. ओके, keep store in glass amber while at room temperature. Second, it is for mist. Prime pump before use. यूज करने से पहले आपने एक पंप हवा में करना है. Prime again if not used within 6 months. If you are using after 6 months, then do prime pump again. Do not shake it. spray onto or under tongue with inhaling the spray. ठीक है, you are inhaling and onto and under the tongue. It's a technique if you are using any kind of spray. Dispense packet content under tongue and let dissolve swallow. Okay. The second about is ointment can stain clothing. So patch apply to clean, dry, hairless skin on any area except below the knee. Not below the knee. Okay, it's not good. Must have 12 to 14 hour free periods. मतलब आफ्टर 12 to 14 आवर के बाद आपने ये अप्लाई करना है ताकि डॉलनेस ना हो. अप्लाई न्यू पैच टू डिफरेंट एरिया ऑफ स्किन. Dispose by folding in half and discard away from children and pets, which is very this is for apply for any drugs. If you are using, then keep away from children and pets. So this is a short and brief and a most important information about angina which we have covered. If you like this video and want me to make more videos, please subscribe my channel and also mention your thoughts and suggestions in comments. Thank you. Till now, Allah Hafiz.